Hi everyone, a very good afternoon to you. Give me a second while I just share my screen. Okay, so thank you everyone for spending your very precious lunchtime together with me. On this hopefully a lot more interactive with more questions asked from you later on the second part of the session. So what will happen is that I will be sharing a little bit of our journey, some of the challenges that we have seen, and also where we see opportunities going forward. Maybe for about 15 20 minutes, and hopefully we will leave that last 15 20 minutes, sorry, 10 to 15 minutes for us to maybe go through some questions that we could have from you, right? So my name is Wai Mun. I'm the founder and CEO of Dr. Anywhere. Dr. Anywhere, we started operations in year 2017 August. So we have been operating for about 4 years, 2 months, and it has been a long journey in that sense, but we still feel that everything is still kind of at the beginning right now because it's really massive, right? Because we're just growing massively right now. When we first started off, it was based on a very, very simple idea. So it was really just creating an app, having a video call function in it, and kind of connecting users to our providers, the doctors, GP doctors in particular. And after the video call, we then enable the doctor to make a prescription, and we send the medication to our user's home, and that was it, right? And that was the end of the journey for a consult and a transaction. And over time, we recognize that there are limitations to how the technology today can address certain medical conditions or not. So there are limitations, and we then moved into expanding our services into also tech enabling offline clinics and bring them online. So today, where we really come ourselves is in tech enabling offline clinics, and also at the same time gelling them with online clinics, and we provide that omni-channel online and offline experience, accessibility to healthcare to our users. We started off in Singapore, and today we are in Malaysia, in Thailand, in Vietnam, and also in Philippines, right? With very, very good partners on the ground as well. It has been, an incredible journey. Today, we find ourselves, having 1.5 million users in Southeast Asia. We have more than 1,800 providers on our platform, and we are starting to see, very, very interesting traction. We're also starting to see very, very, very interesting data on how our users are behaving in that sense, right? And not just the users, but also the providers and also the payers. So in the last 4 years or so operating this, obviously, if you talk to any startup founders, very unlikely they will tell you that they are playing golf every day, right? So it's definitely hasn't been a very, very smooth journey, right? There are challenges every single day, even up to today, right? There are still a lot of challenges in the organization, in the business, dealing with people internally, externally, right? And the product itself as well. But when we look back, we kind of see that there are three very kind of a broad bucket of key challenges that we have seen in our journey, right? So the first one, right, the user, the payer mindset, and how they have changed, right? So I remember that initially when I was starting on Dr. Anywhere, when I first started to talk to doctors, right, they were very unwilling to participate in this, right? They were like, no, this is not something that's useful to us. There are a lot of GP clinics already in Singapore. It's well penetrated in the community, and hence this is useless, right? And we were also talking to our users, and their questions was always, well, I still prefer to do in-person visit with my doctor. How effective is this? I'm not so sure. Yes, it might save me some time. But look, if my insurer agreed to it, then yeah, maybe I might try it out, right? And hence that was the user mentality. And the third bucket of people, right? The third category of people within the ecosystem would be the payer mainly, right? So the payer would be typically in Singapore, the insurer. So when we first started talking to insurer, they were interested, not bought in, but focus maybe was a lot on affordability, right? Like, hey, how can you help me to reduce costs, optimize costs from a telehealth angle, while still kind of not creating a buffet syndrome whereby people just keep using telehealth because it's so accessible right now. Right. So there were a lot of strategies in this regard, and juggling three different parties in an ecosystem to kind of moderate everybody's agenda. To be honest, it was really difficult, right? But I think over time, as the government, right, of Singapore has been very good in creating environment for us to grow, right? So one of the key things that I feel that it was game changing for the industry was actually the Ministry of Health sandbox, right? So that creation of sandbox instantaneously helped to alleviate some concerns from the provider, right, from the doctors who used to think that this thing also sounds a little bit not according to guideline, for example, right? And the payer were also thinking like, is this approved by the ministry? So with that sandbox, now everything started to change, right? People were like, oh, okay, this is getting attention from the Ministry of Health, right? It does seem like the government is supportive of this, and hence let's now join in and participate and see what comes out of it. So that was something that I personally felt that it kind of changed the industry in that regard. And then came the pandemic, of course, right? And COVID-19 has really helped to accelerate the whole industry as a whole. In the sense that the conversation also evolved into something else. So remember, I said that previously the insurers were more, thinking about cost optimization as the key thing. But now, interestingly, it has changed into something else, right? It is now talking about, oh, how can you help me to allow my user to still access healthcare in a very safe manner, right? So unnecessary visit to physical clinics, allow them to still see a doctor in a safer environment. All this now has a very different condition, a very different mindset, and it's all towards how do I optimize the user experience of my customer. Yeah. So now this thing, at least in Singapore and also in some parts of Southeast Asia that we're operating in, we are starting to see that mindset shift. And obviously that's something that has been very useful for us as a whole. Navigating government regulations and policy, right? So this is more in other countries that we see, right? Even in Singapore back then, right? The experience was that we were quite clear that that's the direction that we want to move towards, right? But because of the fact that it takes time for regulation to catch up with the industry, and I guess it's quite normal, right? It's a matter of time that it will catch up, but that matter of time, that time frame, right, is also important for the development of the industry. So in some countries that we operate in, then some of them are not so clear in how they want to how they want to regulate this space. Typically, there is no mention of a telehealth guideline or not. So they are not saying no, they're not saying yes. You can try it, right? But so far, our experience really has been that as long as the company, right, and that is, to be honest, that's how we started off as well, right? That as long as the company is doing the right thing with the right protocol, right, and not trying to do anything funny that is off tangent and drifting away from the intention of the regulation. Generally, we do see positive feedback from the government agencies, and then that leads to more encouraging conversation between us, and also drawing them in to tell them that, hey, please regulate us, right? And that's something that we find that the intent together with the conversation is actually very, very important to overcome the challenge from navigating government regulations and policies. The third one is very, very relatable for at least for our business. I mentioned earlier on that we are in 5 countries in Southeast Asia today. And just to give some context to this, before pandemic happened, we were only in Singapore and Vietnam. We were kind of a starting Thailand, right? But it wasn't as full blown as today. And post pandemic, we had to really go deeper in the Thailand. But we had to also start something in Malaysia as well as the Philippines, and that was actually quite challenging, to be honest, right? As ironic as it can be, right? Here we are trying to pitch virtual visits and so forth, but when it comes to scaling a business, hiring people, trying to build culture, trying to instill some values within our own team, it's something that is more difficult, I would say, when we are not able to be physically there with the team, right? So scaling a business during this time, I must say, it has been quite a challenging journey for us, right? But I guess where the team has done very well is really hiring the right people, right? Who's able to now also start to create their own culture locally, and it has been all very positive as well for us. Okay, so what are some of the things that we have done, DA, Dr. Anywhere, we've done in terms of supporting population health during this period? I think everyone by now can acknowledge that things are very, very fluid, right? Things are changing all the time. And as things changes, as new data comes out, then there will be other policies that comes into play. But by and large, some of the things that we were doing and we are still doing, right, are things like, for example, issuing B2B certificate for seafarers. That's something that we were working with Maritime Port Authority since last year, and we continue to serve our seafarers just at the border of Singapore today, right? We have also been quite active in terms of providing healthcare access to our dormitory workers. So they typically, for the longest time, I think some of us might know that they have been disallowed to get out of the dorm, right? So very simple things like healthcare access, these are things that we also want to be supporting them on, and it's something that our team of doctors have been actively providing them with the support. And the last one, and I think that itself has also been taking a few rendition, right? The COVID home recovery program, and now you have the enhanced home recovery program as well. So we have been committing a lot of resources into helping Singapore, right? To obviously there are many things, right, that we cannot just replace, right? But at least from our point of view, we have been doing what we can to alleviate more resources, so that these resources can in turn be then redirected into something else that can help with the situation. And this is the part that, I must say that, I have to give a big shout out to all healthcare providers right now, right? Some of us who are not on the ground might not understand, but things are really, really, really tight right now. Resources are really tight. I must say that on the ground, the doctors are also feeling tired, right? They are very worn out, and every single bit of help in this regard to allow them to, at least have break time, right, within would be very, very helpful, right? Also in terms of not just accessibility, but also, talking about the quality of healthcare that we're providing. Right, if things were to go on and on, after a while, I'm quite sure with all human beings, right, we then would deteriorate in terms of how we provide that quality service to a consumer or patient. Okay, so where we see opportunities for us, again, 3 points. First one, right? So we do see right now, there is a lot of demand for services outside of just primary care. We are seeing demand coming in for mental wellness, right? So mental health is something that interestingly has been a big topic in Singapore and also the region. We have also been seeing people writing in and asking us quite often, hey, do you have a medical specialist clinic that I can visit, a specialist doctor to talk, about my medical condition that is beyond primary care, right? So that's something that I feel that, it's also an opportunity for us. And last but not least, also talking about how, we want to succeed in providing that omni-channel healthcare, be it via a virtual clinic, via our own in-house clinic. In Singapore, for example, we are 8 of them called DA clinics. And eventually, right, we've also expanded into what we call a home-based clinic. So literally, we have nurses and mobile doctors visiting our users at their home, right, for treatment or advice and so forth. So that's the first point. Second one, we do see a lot of opportunities also in connecting IoT devices. And this is somewhat, very interesting, right? Because it helps to increase the ability, the trust between the platform and the doctor and also the patient. And at the same time, it also helps our doctors to continue to build trust between themselves and the user because of the post diagnosis monitoring, for example. Right. And the last one really being coming up with an enhanced platform with the capability to improve the doctor-patient consult experience. And this is again also could be linked to IoT. This could be a more seamless way of referring downstream between doctors, so and so forth. So these are the things that we are looking at on a day-to-day basis on how we truly enable that whole integration of offline and online to make sure that we are giving our users the best experience. And that brings me to the end of my presentation, right? I will now hand it over to Aloysius.
Thank you very much, Wai Mun, for the rich sharing. We're going to the Q&A session. So I'll pose Wai Mun a few questions. I want to hear your thoughts on some of these, and I'll draw from both the chat as well as some of my own personal questions that I'd like to ask you. So I'll go to kickstart. I have a first question on really telehealth in general. Moving beyond COVID, I think COVID, we're living in very extraordinary times, and hopefully it will come to an end soon, and we'll move into normalcy. When we move into a post-COVID world, for telehealth as a discipline, maybe Wai Mun, maybe you want to share with us your thoughts on what are the key challenges from both the patients, maybe even the providers' perspectives for telehealth, telehealth's growth in the Singapore context. And maybe a follow-up question, we could take both at the same time, is do you see telehealth really competing or complementing brick and mortar medical services in the future? So maybe I will hear your thoughts on these two questions, Wai Mun. Sure.
So I I wouldn't say that I can predict what will happen, in a post-pandemic, into endemic world, in terms of our space. But looking at data from other countries, what happened is that there was a dip in terms of virtual visits compared to the peak of the pandemic. But then it then stabilized and then it started to grow again in terms of the visit on via a virtual clinic concept. When we look at it in a more qualitative manner, I do think that it makes sense, right? When things start to move into normalcy, people would then, try to reconnect with their own provider via offline visits. But after a while, the provider will also, because of the experience that the provider has gone through, using Telehealth as a tool to connect with their patient, some of them then say that, hey, you don't have to come visit me all the time in my clinic. How about, you visit me on this platform, and things can be sent to your home anyway, right? So it does not just increase the user, the patient experience, right? At the same time, it also helps to optimize the provider's time, right? And look, and to link it back to the second question that you asked, and that's where we do see a synergy. That's where we do see complementary kind of a situation, that the provider, now they have gone through this whole period, realize that there's no way telehealth can replace what they are doing anyway, right? But they now start to see, or they have seen, that how telehealth can be used to complement their practice. Yeah, so the ability to use it to complement the practice, to optimize providers' time and say that, hey, you know what, if you are chronic, for example, right, you don't have to see me in the clinic and and clog up the clinic as well, right? Maybe, you can see me online. Maybe you can fix an appointment with me at 8 p.m. or 9 p.m., right? I can do a short 10-minute visit with you, a very quick checkup, and that's it, over a virtual clinic, right? So these are things that, our providers are starting to see, and they're starting to understand that, and they're starting to use that. And I think that this change in mindset will lead to a change in behavior post the pandemic.
Thank you, Aiman. That's really insightful. Moving from the discipline more towards the Dr. Anywhere itself, I'm going to turn to the chat, take a look at the questions there. There are two questions that I'll take together. Sure. Really, when we're talking about Dr. Anywhere as a platform, and you do see quite a bit of additional interest coming in from additional platforms during this pandemic period. What are your own strategies to make this particular platform sticky to consumers so that they can, their longitudinal healthcare needs can be addressed? The two questions in the chat that I'm going to take together also is it a cost charging kind of consideration? And the second question by Renadius, related to, is it about offering different remote devices beyond or different modalities beyond just video and data and voice that you're thinking about? So I'll just take these three questions as a group. Maybe I'd like to hear from Wai Mun.
Okay. There are too many questions. Sorry, I might not remember all of them, but let me tackle them one by one. And Aloysius, I might need help from you later on to repeat some of them. So I think on the first question, right, how do we get users to continue to stick to the platform? There is really no magic formula, right? It's always the same old theory, right, of making sure that once the user has given you a chance to at least visit your shop, right, you better make it sure that you provide the best service, right? You provide the best user experience to keep the user happy. What we find is that users are quite unforgiving into this context. They use you once, they don't like it, but definitely they will not come back again. And if you are lucky, they might leave a 1-star rating on your door, right? So so where we do see ourselves is continuing our effort to make sure that we do train our own providers, right? To constantly give them feedback on where we could improve ourselves, right? And because at the end of the day, although telehealth is a tool, right, the end provider of it is still a human being, right? So the ability for us to now up the game to train them, right, feedback to them, I would say it's a key in what we're doing in keeping the users happy. And so sorry, what's the second question again?
So the follow-up question to that is really, are there angles of cost that actually can enter into your strategy, or other modalities, like say, for example, the second question that's being posed in the chat around offering digital stethoscopes and other modes of digital monitoring devices that Dr. Anywhere is exploring.
Sorry, what do you mean by cost again? I'm
looking at the first question. The first question, I'll just read out verbatim. So how could Dr. Anywhere manage the cost charges to patients at a reasonable rate, which includes the delivery of medicine? So I think that's a specific question. Yeah.
I see. Okay. So I think we have been offering pretty I would say affordable healthcare already, right? Yeah, I mean, sorry, we can never fight the polyclinics, right, in Singapore, right? But that is government subsidized, right? On our side, we do not have subsidies, right? I want to make sure that is clear. But we have been able to use technology, right, through optimizing of time for doctors, optimizing of delivery, and also making sure that inventories are just in time, so and so forth. To now, if you imagine we optimize everything on our system, and the end result is that we are able to now take those cost saving and pass it back to our users, right? And that's what you see today on the end product of how we provide that service as well as that delivery of medication to our users' home. Now, obviously, not everything is perfect, right? We are still, after all, a 4-year, 2-month-old company, right? We are still trying to continue to optimize our cost structure. But I would like to think that today we have been pretty advanced in terms of making sure that that's happening already. Now, then on to the next question, right, on connecting to devices, right? I definitely do think that that would be the next phase in where we are for all, in fact, most of the telehealth provider, right? Which is to be able to connect to all this Internet of Things, right? IoTs, right? Like your stethoscope, your BP machine, so and so forth, to allow our doctors to gain more insight into our users' health, right? And that potentially then translate into deeper trust between them and our platform, right? When I say them, I mean that the deeper trust between the provider and our platform, as well as the users in our platform. And then that hopefully then go back to the very, very first question that we asked, right? Which is how do we keep our users coming back, right? And these are things that I think it all helps.
Okay, thank you very much, Wai Mun. Unfortunately, we run out of time. Thank you very much for the rich sharing that you have provided, and also thank the audience for the questions that you have put together. We have now come to the close of the session. Thank you, Wai Mun.